HILDEGARD PEPLAU was born on September 1, 1909, in Reading, Pennsylvania, and died on March 17, 1999. One of the most leading nurses and theorists, known by many as the nurse of the century and the mother of psychiatric nursing. In 1997, she received the World of Nursing highest honor, the Christian Raymond Prize, at the ICN Quadrennial Congress. In 1996, the American Academy of Nursing honored her as a living legend, and in 1998, the American Nurses Association inducted her in the ANA Hall of Fame. For Peplau's theoretical sources, the theory of interpersonal relations was greatly influenced by Harry Stack Sullivan's theory of interpersonal relations in 1953. The theorist was also influenced by Percival Simmons, Abraham Maslow, and Neil Elgar Miller. Next up is the fourth meta-paradigm of nursing by HILDEGARD PEPLAU. For her, person is viewed as an organism that strives to reduce and minimize the tension generated by needs. Environment is described as a psychodynamic meaning that receives attention, emphasizing on the patient's culture and tradition. Health for Peplau is defined as an ongoing human process in the direction of creative, constructive, productive, personal, and community living. And lastly, as for nursing, it is viewed as an interpersonal therapeutic process that functions cooperatively with other human processes that make health possible for individuals and the communities. It is an educative instrument, a maturing force that aims to promote forward movement of personality. The theory of interpersonal relations relates to modern concepts such as motivational interviewing, client self-management, making informed decision, and client engagement. It also involves the healthcare professional working to understand their own behavior as well as of their clients. The four phases of interpersonal relationships are: first, orientation. This is when the client exposes the issue that they are seeking the nurse support with. Second, identification. It involves the nurse educating the client. This stage of the relationship sees a focus on building respect and working towards meeting the needs of client. Another phase is the exploitation. It is where the nurse aims to behavior modification for the client. Ideally, the client's behavior change will help to meet their needs, and the nurse will not be dependent upon as heavily. And lastly, termination, where it involves the client being able to self-manage their initial issue of concern. The nurse may eventually then release the client from their care. Peplau's theoretical model of interpersonal relations revolves around psychodynamic nursing, where the nurse seeks to understand her own and other behavior and to apply the principle of human relation to one's identified need. In this model, the nurse adopts many roles to move the relationship forward. She can be one or many of the following. First, as a stranger, where she first meets the patient and views him not judgmentally and objectively to identify his needs. As a resource person, she provides any needed information to him. And as a teacher, she educates and informs to enhance understanding of his needs. Another role is being a leader, where she guides the patient through cooperation and active participation as he strives to fulfill his needs. Next is as a surrogate. She assists the patient to identify similarities and differences between them, which helps to determine one's dependency and independency. Lastly, as a counselor, the nurse helps the patient learn from his own experiences to increase his understanding of them. There are three assumptions inherent to Peplau's theory of interpersonal relations. Explicitly, the kind of person the nurse becomes makes a substantial difference to what each patient will learn as he receives her nursing care. Secondly, fostering personality development toward maturity is a function of nursing and nursing education. Nursing uses principles and methods to guide the process towards one problem resolution. Implicitly, she asserts that nursing profession has a legal responsibility for the effective use of nursing and its consequences to patients. Next up is the application of the theory to the nursing practice. Peplau's theory is significant in terms of different phases of the nurse-patient interaction and different roles the nurse can play in giving nursing care to patients. It becomes important for nurses to understand the principle behind each of these concepts so that clinical nursing will be more meaningful for the nurse. Eventually, this will translate to better outcomes for the patient like improved health, prevention disease, or enhancement of care facilities. The work of Hildegard Peplau represents the most significant influence worldwide on the development of psychiatric nursing practice. Her use of the theoretical of interpersonal relations created the basis for defining the potential significance of the psychiatric nursing role as a therapeutic agent. Peplau's writing have helped clarify the broad range of roles required of the nurse in general and in particular within psychotherapeutic nursing. Last to discuss is about the critique for this theory. First is the clarity, which has two subdivisions, that semantics and structure. Semantics, which deals with the meaning and implication. The theory has clear definitions of concept, and the definition is explicitly and implicitly congruent. For structural, the theory has easily recognizable underlying concepts. The structure of theory is linear but not consistent. Second is the simplicity and complexity. Peplau's work is the both simple and complex. She is seen as simple by many in her reliance on a few concepts such as interpersonal relations, communications, and anxiety. Next is the general type of critique. It pertains to psychiatric nurses but also can be applied to relationships between clients and any HCP. The roles of client and HCP are predetermined and differ from any other human relationship. Another type of critique is accessibility. There are two indicators of effective interpersonal relationship: emphatic linkage and the progression through stages. Lastly is the importance of theory of interpersonal relations, which has needs for relationship, namely confirm of self-worth, providing a sense of connection with others and support self-esteem.